It's a fascinating perspective to assume that a physician would see nutrition as beneath them because I read Dr. Palmer's book Brain Energy. I read your book. To me that there's a complex science that drives a lot of the work that you're doing that most people aren't aware of. We'll get into some of that today. And with most of psychiatric drugs being prescribed by general practitioners, they at least have the ability to run various tests and to be investigative in being able to identify underlying pathways that are leading to poor health and then recommend specific interventions. However, it seems to me that the field is corrupt. I mean, how else would one, when you go and see your cardiologist or when you go see your GP, and they're prescribing a heart healthy diet, and in that heart healthy diet, they are recommending food choices that, from what I understand and from what I've learned and what I think you would advocate for, are actually going to make them sick. So let's just open it up to, what you've learned. And I think it intersects with understanding like in industrial kind of corruption of scientific research and their influence on mainstream doctors. So what are you learning? And this education, how is it now informing your own treatment of typical presenting mental health presentations, which anxiety and depression, mood related problems, I think are what is most common as far as presentations. But there's also some more severe mental illness that are also being targeted with some of this understanding. Let's open it up to what you have learned and how you're applying it.
Well, for many years, I was taught that mental health problems had psychosocial roots and biological roots. So I was taught to, psychosocial roots, things like, stress and trauma and your mother, and I was taught to address those problems with psychotherapy. And I had very good training in psychotherapy in my program as it happens. It was one of the programs that emphasizes psychotherapy more than many others do. And I was taught that mental health problems also had biological root causes, chemical imbalances, genetic vulnerabilities, that could, lead to mental illness. It runs in your family if you're under a certain amount of stress or so on, that sort of wakes up this vulnerability, and I was taught to address those with medications. But I wasn't taught to think about what causes those chemical imbalances in the first place, or whether there was anything else people could do biologically to address them. And so that was very unsatisfying. And of course, the medications fail most people. I mean, they do have their place. We still need them for emergency situations. They can be, in certain cases, life-saving. And so I've definitely seen them help people. But most people, honestly, do not respond very well to medications. And so, what I thankfully came to understand after years of studying it for my own purposes, I came to understand that the most powerful way to change brain chemistry, though medications can change brain chemistry, the most powerful way to change your brain chemistry is with food, because that's where brain chemicals come from in the first place. That's where every element of the brain comes from, every molecule, every cell, every membrane. And so what I came to understand was that mental health problems are largely, not entirely, but largely sort of very, very strongly influenced by environment, and not just environment writ large, because we know we've been taught for a long time that certain elements of the environment, things like stress and the quality of your relationships and things like exercise and things like that, can influence your brain. But food and the way we eat, it turns out, and this is I just really enjoyed discovering this because it's such an empowering thought, is that so many of the actual root causes of mental health problems, which we now understand really over the past 10 or 15 years has become very clear, the root causes aren't necessarily chemical imbalances. I mean, chemical imbalances play a role, but if you go deeper, to sort of what might cause those chemicals to become imbalanced in the first place, are inflammation of the brain, oxidative stress, which is why we're told we're supposed to eat lots of antioxidant rich foods, and insulin resistance or prediabetes, sort of high blood sugar and insulin levels. Um, all of these, you need to look no further than the modern diet to find ingredients that directly and powerfully promote those three
Mm.
root causes, not just of mental health problems, but of just about every physical and mental health problem we fear and face as a society. So why not start there?
Yeah, it's such a good point. And the problem that exists is there's so much misconceptions about food that people don't know what to believe anymore. And this is the challenge of me in clinical practice. So if I'm working with someone who might be anorexic or
Mhm.
bulimic, and I do believe in the power of the diet to restore health, many of them are actually believing the foods that they are eating are healthy. And that could be like, eating oatmeal in the morning and
Yeah.
eating a lot of foods that are like fruits and vegetables and so forth, which they're told healthy grains. And I'm noticing that there's like this blood sugar roller coaster that they're going on, and it's potentially predicting a later binge and a purge. And it's never discussed in those terms. There the idea of incorporating more red meat, high protein, healthy fats is something that they're scared of, obviously, because for decades there's been conditioning about those type of foods as contributing to cancer and heart disease and a number of things, especially weight gain if you're involved with an eating disorder. So what are some of those misconceptions about these quote unquote brain foods that we've been told, and how are you then making changes with your patients?
Yes, and the reason I wrote the book is because if you have the right information about food, which most people do not, if you have the right information about food, changing your diet can be a powerful intervention, therapeutic intervention for even for very serious chronic mental illnesses. I mean, even for people who have been, struggling with schizophrenia or with bipolar disorder for decades, who have tried every medication under the sun. Even for people in those situations, with the right information, you can see in some cases dramatic improvement in symptoms and sometimes even full remission, complete recovery from these conditions. So for example, the ketogenic diet, which is one of the cornerstone of my practice, I use many different types of diets in my work. But the ketogenic diet is a particularly powerful intervention, and is the one that has so much science behind it, and mounting evidence in terms of published evidence in terms of its potential, its ability to heal people in ways that no medication can. So, but if I'm going to recommend a ketogenic diet to somebody, I'm going to have to then deal with the 10 to 20 questions that follow. Well, okay, this is a high fat diet. Isn't fat bad for me?
Mhm.
This diet doesn't have any whole grains in it. Isn't that going to be bad for my digestive system? This diet doesn't contain, the full rainbow of fruits and vegetables. Am I going to get cancer? I mean, this diet, the foods that are easiest to incorporate in this diet and most nutritious are the animal foods, things like meat and seafood and poultry. Aren't I supposed to be leaning in a more plant-based direction? All of these myths about nutrition, which are so ingrained in our psyche over decades, stand in the way of people being able to readily accept these diets, not just people, but the clinicians that take care of them or trying to help them, stand in the way of people's good mental health. Because when you eat the wrong way, the brain will not work properly. So if you're I was thinking about this the other day. It's a koala, right, that eats eucalyptus all day.
Yeah.
Um, if you change the diet of a koala and instead of eating eucalyptus, if you're going to eat dandelions for the next 10 years, I'm sure that koala would not thrive. And perhaps the koala may even come down with severe depression or anxiety. I don't know what happened to the koala, but something bad is going to happen. because your body cares very much about getting its needs met. If you're not eating the right way, then you cannot expect to function. You cannot expect optimal function. In fact, it would be strange to expect yourself to function optimally if you're not feeding yourself optimally.
So, Dr. Eid, you said the most powerful way to change brain chemistry is with food. How would the average person who may say like I feel okay, but maybe I don't feel optimal, like how do we know if maybe our brain isn't functioning 100% because of inflammation or just oxidative stress? Like we may not be schizophrenic, but maybe we can improve. Like what are some of the other indicators of that?
Yeah, I love this question, Sean, because most people are walking around with suboptimal mental health without really realizing it.
True.
We've come to expect very little of ourselves, and we've come to expect our brains and bodies to deteriorate over time, that that's just supposed to be normal. We expect to crumble under stress and perhaps never recover again if we go through a trauma or a serious loss, which most of us face significant stresses and losses throughout our lifetimes. That's part of the human experience. So resilience, right? So what are the markers of good mental health, robust mental health? Resilience, the ability to tolerate stress and tolerate frustration without falling apart, the ability to recover from stress and serious losses, the ability to navigate challenges, um, and even embrace them in certain cases. The ability to navigate relationships without over reacting to criticism or to disappointment. Just sort of a robust internal stability. Um, Having enough energy to get through the day, mental energy, being able to get things done, being effective in your life, accomplishing what you set out to accomplish, feeling, and I think a thing that there's a phrase now that's used so often that we think of it as normal is brain fog.
Mm-hmm.
So a lot of people say, well, it's brain fog. Well, what is that? And I've been asked in numerous podcasts, like, what causes brain fog? Well, um, you know, we don't formally study brain fog. It's not an official diagnosis, but it's a real thing that most people are experiencing, at least on some semi-regular basis. Well, if the brain is inflamed, perhaps it can't work as well. If the brain is under constant attack from oxygen-free radicals, from excessive oxidative stress, from eating the wrong way, from eating too many refined carbohydrates and vegetable oils and things like this that attack the brain from within, maybe then the brain's not going to think clearly. Um, Insulin resistance, prediabetes, which is now rampant. It's pandemic level around the world. More than half, depending on which study you look at, anywhere between 52% and 93% of us have at least some degree of insulin resistance or what's sometimes called prediabetes. The problem with insulin resistance, I like to tell my patients, if you have prediabetes or diabetes, you don't just have a blood sugar problem, you have a brain sugar problem, because the more insulin resistant you are, and the longer you've been insulin resistant, the harder it becomes for your brain to turn glucose or blood sugar into energy.
Doc, you bring up insulin resistance. Can you define that for our audience? And how do you determine if you'd be insulin resistant? Are there certain biomarkers that can be identified with a healthcare professional?
Yes. So I'm so glad you asked this, because I can give your listeners right now the tools that they need to test themselves for insulin resistance. And it's actually very easy to do. Some of these you can do at home without ever seeing a health practitioner, so they don't cost you anything. And others are very inexpensive, readily available blood tests that might cost you $10 or $20. And so very simple. So right now, the way it is right now, if you go, let's say you go to your doctor for your annual physical, and for them to evaluate your metabolic health, what they will usually do is they will test a fasting blood glucose or fasting blood sugar. And that's your blood sugar level after you've not eaten for at least 12 hours overnight. So it's, of course, going to be at its lowest point. And then they're going to test your hemoglobin A1C. So a hemoglobin A1C is just a measure of, it sort of gives you an average of your blood sugar over the past 3 months, right? So if your hemoglobin A1C is too high or your fasting blood glucose is too high, they're going to say, oh, you have a problem. You're either on your way to diabetes, you're already there, and you may need to take medication, or you may need to exercise or change your diet. But these tests are really excellent at detecting type 2 diabetes once it already has developed. The type 2 diabetes develops it can take up to 20 years for type 2 diabetes to develop. What's happening over that 20-year time span is, your fasting glucose is going to stay nice and normal. But what's keeping it normal is increasing levels of insulin that your body is having to pump out to manage all of that excess glucose that's coming into the diet. So you don't want to know what your blood sugar is first thing in the morning when it's at its lowest anyway. You want to know how much insulin is your body needing to produce to keep your blood sugar in a normal range until it can't do it anymore. So that's called pre-diabetes or insulin resistance. Lots of names for it. So we want to know is what your fasting insulin level is. How high is your insulin when you wake up in the morning? And the reason why is because when your insulin level is running too high, the body will naturally, cells throughout the brain and body naturally will try to protect themselves from being overstimulated, bombarded by too much insulin. Insulin's a hormone. All cells will protect themselves when hormone levels are too high. They will tone down their response to that hormone. That's called insulin resistance. So insulin is trying to send messages to cells, really important messages to cells, and the cells are going, enough. You've been kind of screaming at me all day long. I just need to tune you out a little bit so that I can take a break. That's insulin resistance. And so the higher your insulin levels run, over the course of your life, the more insulin resistant you'll become. And that's not good because cells need to be able to pay attention to and respond to insulin's messages. It's not just about regulating blood sugar. Insulin is not just a blood sugar regulating hormone, which is what I was taught in medical school. Insulin is a master metabolic hormone. It's a master growth hormone.